Healthcare is the only thing in our economy where the consumer doesn't have a direct connection to the cost of the product. What happens to prices when consumers are connected to costs? They go up.
Healthcare in America isn't just complex, it's chaos, with the information and power stacked against employers and patients. On Margin of Care, we set out to rebalance that scale. Today, I'm joined by Chris Hogan, a principal at Benefits Commerce Group, an Alera Group company. They've been honored a whopping 4 times by Inc. magazine as one of the fastest growing private companies in America. And Chris has the special ability to take huge, complicated ideas and turn them into the kind of compelling stories that spur people to action. In this episode, Chris breaks down the stickiest challenges facing brokers and employers today and paints a picture of how American healthcare can evolve to better serve the people it's meant to help. Well, Chris, thanks for joining me today. Really appreciate you taking some time to sit down and talk.
Great to be here.
For the benefit of those listening, just get you to share a little bit about your background, about what you do, and we can kind of dive in.
Sure. Yeah. My career was about 20 years or so on the carrier side. I kind of woke up one morning and said, everything I've done when I go to work was been for the objective of making money for an insurance company. And wouldn't it be fun to take everything I've learned in all those years and try to reverse engineer it with the objective of saving money for an employer? So that's really the bedrock that my partner Scott Wood and I built Benefit Commerce Group on about 14 years ago or so.
Along the lines of how do we save money for employers, we are seeing that US healthcare costs, no matter all the different strategies that have been out there for the last several decades, they continue to increase at near double-digit levels at this point right now.
Yeah.
It's really going to create a lot of strain and a lot of pressure for employers. It's going to create a lot more strain and pressure on employees who just don't have the liquid assets anymore to actually afford care when they need it. I would love to get your point of view. Past strategies, whether it's managed care back in the 90s, whether it's the era of consumer-driven plans, the point solution era of the 2010s into the 2020s. Like, why are we still actually having this conversation about double-digit increases?
Yeah, I think I'm going to paint with a broad brush here and acknowledge there's a lot of significant exceptions to the rule. But I think that our industry, if you look back retrospectively, one of the things we've been very much guilty of is focusing on rates, right? What can we do to get a cheaper rate? But I always love talking to my clients about what they're doing on workers' compensation or other risk related. The story that I always hear back is we figured out how to improve the quality of our risk, and then the rates took care of themselves. And I think we get it backwards in health insurance. I think that as an industry, we basically say, let's get the cheapest rate and hope that the risk will kind of follow from there. And that's just a mistake. I think if we took some lessons from property and casualty and said, if we can improve risk, then the costs associated with that risk are determined to go down.
Yeah, and I think it's important right now. I mean, we like to use sort of this anecdote. If you look back to 2008, like one of the major things that happened in 2008 with the financial crisis is you had GM, which had offered really rich pension benefits, really rich employer-sponsored health benefits for all these years. Suddenly, the expense for those programs was approaching 9% of their overall revenue. Yeah. Next thing you know, they're filing for bankruptcy, they're seeking government bailout, they're having layoffs, et cetera. One of the things that we're seeing in our data right now is that left alone for the next 5 to 10 years, many employers in the US are going to be hitting that magic number of 9% of their revenue tied to healthcare expenses. So when you think about the root cause of cost and affordability issues in the US right now, what is that root cause? What are those root causes?
Healthcare is the only thing in our economy where the consumer doesn't have a direct connection to the cost of the product. The product's not health insurance, the product's health care. If you ask 50 Americans, what does it cost to go to the doctor? They're going to tell you what their copay is. And that is not what it costs to go to the doctor. But if Dr. A charges $200, Dr. B charges $500, and Dr. C charges $1,000, but you have a $25 copay no matter what the behind the scenes expense is, what do you care? In fact, you might even look and say, Dr. C is the most expensive, must be the best. Or you might say, geez, I pay all this amount in premium. I'm going to stick it to the insurance company and stick them with a big claim. The bottom line is, for good or bad, the consumer is not connected to the costs. Well, if you think back to the first economic class that you took in junior high school, what happens to prices when consumers are connected to costs? They go up. So nobody should be surprised that that's what's happening in our healthcare system. It has happened. I mean, here we are all these years later and we haven't done anything about it.
Yeah, I think the other thing too is like what's driving agendas right now for health insurance companies, what's driving agendas for providers and health systems right now, and it's revenue. And ultimately revenue means we're going to have more people in beds right now. We're going to have more utilization. It might be utilization in a bad way right now. What can we do to actually reward doctors, reward health systems for doing the right thing, for driving better outcomes? Because right now their rewards are coming in the form of we're incentivizing by having more care, more utilization, more waste, et cetera. Like what actually needs to happen within the health system to really kind of drive change?
The big miss of the Affordable Care Act, in my opinion, I think if there was something in there that were to change the underlying economics so that the providers were incented to keep people happy, because you're right, the only way that a hospital makes money is to keep beds full. The only way that a doctor makes money is to keep the waiting room full. But if there was something in there to reward them to keep people healthy, that would be good for everybody. When we were first getting to know Garner, we did some of our own research because one of the fallacies or one of the beliefs that we had was that it's probably way harder to see these top doctors than the lower performing doctors. And the really embarrassing truth is it's not. The wait time to see the best doctors was the same as the wait time to see the lower quartile doctors. And I make the joke all the time. We're fortunate enough to live here in Phoenix, home of Pizzeria Bianco, some of the best pizza in the country. I'll wait an hour for Chris Bianco's pizza. I'm not waiting an hour for Domino's because I know the difference between good pizza and not so great pizza. We don't know the difference between good healthcare and not great healthcare. So, one of the things that's an interesting discussion is as this concept takes root and goes from a 0.1% market share to 1% to 10% to 20%, is there going to be some impact on supply and demand? Is there going to be a longer wait time to see those top doctors? And let's be honest, yes, there will be. As patients are going to be incented to fire their current doctor and go to hire, work with the better performing peers, is that going to create some disruption in supply and demand? The answer is yes. Those lower performing doctors are then going to have a decision to make. Do I get better or do I go out of business? And that's the decision that everybody in business makes every day. I think that's going to be a really, really powerful, healthy thing for our system. Because to your point, there's not a lot of incentive other than personal pride for a doctor to get better at their craft. They don't get more business if they do.
Yeah, I was actually kind of thinking through this, like from a behavioral economics perspective, from the doctor's perspective, from the system's perspective, like is it the incentive that's going to drive the better behavior or is it actually going to be a disincentive? And we're actually starting to see that play out right now where a system has come to Garner and said, hey, we're losing patients right now to Garner. What can we do to actually up our game so that you're recommending our doctor?
There you go. That's exactly what I said in action. It's great.
What's it like to be a healthcare consumer these days? Like, do you feel like you're empowered?
Yeah.
Do you know how to get where you need to go?
No. Yeah, I'll share a recent example. So I wore glasses and contacts, most of my life. Many years ago, I got LASIK surgery. Incredible. You wake up in the morning, you see the alarm clock for the first time in your life, and swimming and without contact, it's wonderful. The last couple of years, I'd noticed that my vision was slipping a little bit. So I hadn't been to the eye doctor in a long time. I went back to the eye doctor and said, am I a candidate to have this surgery redone? Because it's been a bit now. And the answer I got back after the exam was, well, we found out why your vision's slipping. You're a little bit young for it, but you have the beginning of cataracts. Good news for you. I have a surgeon on our team who will do this surgery for you. Let me get you connected there. I used Garner and saw that this guy was not a very good surgeon. I also found a surgeon right around the corner from where I live who scored a 99 on Garner for cataract surgery. What an interesting discussion with this doctor when I went to him for the first time. He asked me, who sent you to me? I said, nobody did. So how'd you get here? So I started to tell him about this. He's like, I don't know about this. I didn't sign up for this. I'm like, that's why it works. Yep. Because it's not an opt-in thing. You're not paying to get into it. He, of course, loved it because he scored a 99. But yeah, it's just, we're all sort of out there doing our best, trying to accidentally bump into quality healthcare, and the industry stopped trying to solve it.
What's it like as a consumer that's enrolled in a traditional PPO type of a product, and you say to your health plan, you call up their advocacy or their concierge and you say, hey, I would love to go see a really good doc in your network. Like,
sure.
What's that like?
So again, kind of no knock on insurance carriers. They're doing the best they can. But the underlying terms of the contracts that the carriers sign with the providers has a clause in there that they will not favor one participating provider over another. So what that means practically for you and I is that if you and I or a family member have a health event or a diagnosis And we called our carrier and said, look, we want to be super proactive on this. This is serious. Who's the best specialist for my family member to see that's going to help them with this? The answer you're going to get back is, here's a phone book. Here's a directory. Figure it out yourself. They're not allowed to tell you. Even if they want to help you, they're not allowed to. There's just something really wrong with that, right? How can I be expected to be a consumer? I'm a construction worker. I'm a truck driver. I'm not a healthcare economist. You're telling me here's a directory?
Here's a directory, which, by the way, are these doctors still in the network? Are they retired? You know, did they ultimately change office addresses? Is their phone number different? And notably, are they actually accepting a new patient? Like, we'll actually get my kid into that doctor in the next 12 months too. So I want to shift gears just a little bit. What are some of the mistakes that employers are making right now when you kind of think about the root causes of what we're talking about?
Well, we talk a lot about how an employer should run their health plan like they run their business. And because not to be, glib about it, if you ran your business like you likely run your health plan, you'd be out of business. For most employers, their health plan spend is in their top 5, so they probably have a very disciplined approach to how they manage items, 1, 2, 3, and 5, but not 4 with their health plans. I want to spend as little time as possible on this and, don't get into the details. I got other things to do. So in some ways, it's good that healthcare costs have escalated such that there's more discipline, there's more focus from the C-suite. So we talk about that a lot. Like, what would you do in terms of designing the way you run your business to incent your employees to do things that are favorable to the results for your business? You would bonus them. You would, evaluate them, all of that. Well, why don't we design a health plan that is similar to that in spirit? Because we can expect the same kind of outcomes that you got for your business.
Like performance-based care utilization.
Yeah, right? Yeah, I mean, I think of some of the groups that we see that, again, they're just trying, right? The costs are so high, they're desperate for anything. But, maybe they have a high deductible and then have an HRA underneath it, and they tell the employees, like, we'll pay the first $3,000. It doesn't matter what you do, whether it's something that's good for you and good for the company or bad for you and bad for the company. And that's not how you run your business.
Sounds like you're throwing money in the air and lighting it on fire.
You would never tell your key employee at performance review time, you did a lot of things that were detrimental to the success of our organization. Here's your raise.
So talk about a story. You guys are out doing really good work with your clients right now. Talk about a story where that client has faced the problem of high costs, that they've kind of faced this problem of suboptimal member experience. What was the script? How was that script flipped as you worked with that client?
So one of the most meaningful discussions I remember having in recent years was a review we did with a nonprofit client of ours. And their team, with our team's help, kind of did a retrospective review for their board, kind of the results that we collaborated on since our partnership. And the 3-year number was $3 million. To have the CEO of that nonprofit kind of look me in the eye and say, do you know what $3 million worth of our services looks like in our community, the community that I live in, that my family it grew up in? It's not in the stock price of an insurance company. It's back here we were able to do $3 million worth of good as opposed to spending $3 million on healthcare. I mean, that type of feedback is just so rewarding and so motivating. And that's kind of why we try to design, strategies that are tuned into that.
I've got one more question here. If you had a magic wand right now and you could fix the cost and delivery problem in the US, what would you target first? If you were Doge right now addressing this, what would you focus on first?
Well, the first thing that I think that I wish someone would take a hard look at is differentiation of discount by insurance carrier. I just don't see any reason for that, right? That all that happens when one carrier has a better discount than the other is that they go and take the business of the inferior discounts, and the hospital who was resistant to giving everybody that better discount ends up paying on that anyway. And I think level the playing field. Again, I'm in utopia world, and let's have all the carriers compete on something other than unit cost.
Everybody get a percentage of Medicare or whatever it ends up doing.
Exactly. Yeah. And maybe your insurance company's really good at consumerism, and maybe mine's really good at wellness, and maybe Joe's is really good at customer service. Let's compete on the capabilities, not on an unfair advantage that they sort of bully their way into.
Okay, I lied. One bonus question here. What hard choices are employers going to have to make here in the next 5 to 10 years in order to actually maintain, business profitability?
So I make the joke a lot, but it's serious, that the benefit plan is the rope in a game of tug of war between HR and finance, right? That every renewal time, every planning time, it's finance saying, I get pressure from my investors and my private equity. Rope goes this way. HR says, you're tasking me with finding the top talent in our industry, in a really challenging environment. Rope goes that way. And there's a lot of strain on it, back and forth. So one of the things that we love to do is to model what that continuum looks like exactly. So it's kind of show, this is what you're doing right now. This is where you're likely going to go to at market trend next renewal. Here is an updated modern solution, always leveraging Garner, that's going to create a huge pot of money for you. So we're not going to take things away from your employees. We're going to keep things actuarial value neutral, but we're going to create a big pot of savings. And then we're going to go the opposite. I call it the channel marker presentation. Here's the over here. This is budget neutral to what you're doing right now. We're going to spend all that savings we created in the previous scenario on making things better for your employees. Which one of these is best aligned with your current objectives? Are you someone who's really struggling financially, or are you someone who's got a bucket full of private equity money and you're happy to burn it? So, somewhere on that continuum is the perfect place for every employer. There's no employer that operates outside of that continuum.
Yeah, I think one of the things I particularly like about Garner is you have the ability here, I think in a pretty novel way, to balance economics and empathy. So really satisfy the CFO while you're also satisfying the CHRO at the same time. And you don't have to rob Peter to pay Paul. Like, everybody can win in a solution. And at the end of the day, when everybody is winning, it's also driving improvements in the healthcare system too. So
we had a finalist meeting recently where there was one question that our firm and several others were asked to address. How can you save us 20% without hurting our employees too much? So we, very much featured Garner in that discussion, in that solution. And at the conclusion of that presentation, their CEO looked at me and said, first of all, he said, why doesn't everybody do this? Which is my favorite thing ever that anybody says. But he also said, well, what are your competitors going to say about this presentation? I said, I can't predict what they're going to say. What I can predict is none of them were able to show you how they save 20% without hurting your employees. Every discussion, and I wasn't in any of them, but I bet you every discussion was why you should feel okay as the CEO of this company to hurt your employees just a little bit in order to save a lot. Am I right? And he said, yeah, that's exactly what each one of them told me. It can take away, and 20%. We modeled an actuarial value superior solution with Garner and still save the 20%. But I also think that our industry has a pretty well-earned reputation as being obsessed with gimmicks and shiny objects, and they come along and we're obsessed with them and then they fade away because they didn't work. And that's why I think identifying and incenting the use of the highest quality providers from the network that the employer has already chosen to partner with, that's the definition of a sustainable solution.
Yeah. Well, Chris, man, thank you for being such an amazing partner. This was an awesome discussion. I learned a lot and look forward to partnering together more in the future.
Yeah, appreciate it. Thanks. Happy to do it. It was fun.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.